Today, we're gonna talk about affordable healthcare solutions for new parents. Welcoming a new baby is a joyous occasion, but it can also be a little bit stressful in the sense that it brings with it a lot of financial obligations, including those around health and health insurance. I'm gonna share with you a story today that will hopefully show you that you have more options than you think. So let me tell you about my client, and let's call her Susan, just to protect her privacy. So Susan came to me and she had a 2-year-old baby. Susan's baby, before the baby was born, they made sure to get the best insurance plan that they could on the individual market. Now, they were both self-employed, and the parents were, and then the child, they said, they knew like the babies equal bills, and I just know that I'm gonna go to the doctor all the time, and what if the baby's sick or has to go to the ER? I don't wanna end up, in a situation that's unexpected. So they actually splurged. Well, let's just call it like they stretched their budget a little bit more, and so they were willing to pay more monthly on their monthly premium, and in order to have not have to pay so much on the back end. And so they came to me and they had a gold level plan. So the plans on the marketplace are in different tiers. So they start at the bottom with bronze, and then it's silver, gold, and platinum. So they had a gold level plan. These are great plans. Their pediatrician accepted the plan. Doctors were all in network. The hospital was in network, and it worked pretty good for a while, even though it was pretty expensive monthly. And so what she started to notice is after a while, like every time she would go to the doctor with the baby, they would also get bills, and the bills were substantial. To where they thought that they were going to be really well covered, they still had to pay out of pocket, and they were paying that big amount monthly. And even if from the first and the second year, the plan actually renewed and increased in the monthly premium. So when they came to me, they're like, look, is this the right thing that we're on? I feel like we're still paying out of pocket. We're paying a lot monthly, and there's always extra unexpected bills. And so I look at their situation, and we were able to get him approved, the little boy, on a private underwritten plan on a nationwide PPO network, where they actually paid about half of what they were paying before in monthly premium, and they have pretty much everything covered that they need. They have coverage for vaccinations. They're covered for the well visits for the baby. They're covered for when the baby's sick or has an accident. They have supplemental accident coverage on their plan as well. And they're paying half the amount of the premium. And not only that, but the difference is that they're getting more access to doctors and hospitals. So they like to take trips and travel to New York to see their family. They like to go to California to see the husband's family. And so their baby's gonna be covered regardless of where they go. So she was already happy. And then a couple of weeks ago, she calls me and she's like, Alex, I just got this check, like an actual check, money check from the insurance company. Is this a mistake? Is my plan canceled? And so we looked at it, and it came with an EOB. And what it was is actually that what the doctor charged the last time she took her son to the pediatrician was actually less than what the benefit was that she got on her plan. And so the extra money of the benefit went to her directly. So she actually got money back from the insurance company because she took her son to the doctor. And that was so new to her. And it's also new to a lot of people. It was new to her because on the previous plan, she had to pay out of pocket every time that she went. And so long story short, situations with children, especially when they're young, they change all the time. What they need when they were born may not be what they need when they're 3 years old. So it's important to keep revisiting. And when something doesn't feel right, like with my client Susan, we can evaluate it. And if you need help doing that, if you need an agent just to review what you already have, even if I didn't help you get the plan, I'm happy to review your plan and see, is this really the best thing for you right now, given where your children are in age and given their specific health situation and given your budget. Maybe there's something else that we can enroll you in, something like a plan like what I got for them. So you can find me on alexthehealthagent.com or follow me on Instagram. Don't forget that my services are actually completely free to you because the insurance companies pay me. So that's good news for you, and I'd be happy to help you and your family. And if you like this video or you found it helpful, please share it and also comment and like it.